Welcome back to Health Flash. Have your knees started making a sort of popping or clicking sound when you walk up the stairs? Do you feel a strange catching sensation when you stand up from a chair? Or maybe an undeniable stiffness when you first get out of bed in the morning? Well, if you're not in your head right now, trust me, you are absolutely not alone. Millions of adults experience this exact type of knee discomfort as they get older. But what if I told you that in many cases, you can naturally improve how your kneecap moves and actually make your knees feel decades younger? Today in this explainer, we're going to unpack the science of joint health and give you a highly actionable blueprint to protect your knees naturally.
Okay, let's dive right into this. If you're experiencing these kinds of sensations, it's incredibly easy to just write it off as getting older or assume your joints are just permanently worn out. But the scientific literature actually paints a much more optimistic picture. We aren't just here to validate what you're feeling today. We're going to translate the latest clinical guidelines and biomechanical data into a clear, science-backed blueprint. We'll explore the mechanical forces at play, the surprising lifestyle factors that amplify your pain, and exactly what you can start doing about it.
Here is our roadmap for today. We'll start by decoding your knee pain. Look at the kneecap's hidden role. Go over strengthening your knee defenders. Uncover a really surprising footwear connection. And finally, we'll talk about why sleep might just be the ultimate painkiller. Let's get started.
Section 1. Decoding your knee pain. Let's understand what those sensations in your joints actually mean.
Now, a really crucial distinction to make right out of the gate is the clinical difference between clicking and locking. So many people hear a click and instantly panic, assuming their cartilage is just crumbling away inside there. But clicking is often just the totally harmless sound of tendons snapping over structures or simply gas bubbles popping within the joint fluid. If there's no pain, it usually doesn't require any treatment. However, true locking is an entirely different story. This is when your knee becomes physically stuck, like you literally cannot fully straighten it. This happens when a tissue, maybe a torn meniscus or a loose piece of cartilage, creates a physical block inside the joint. I want to be super clear on this. True locking, especially if it happens after an injury or comes with severe swelling, is not a DIY fix. It absolutely requires prompt medical evaluation.
Moving on to Section 2, the kneecap's hidden role and exactly how mechanics drive your discomfort.
So, a massive piece of this puzzle is understanding a condition known as patellofemoral pain syndrome, or PFPS. If you've got pain right around or behind your kneecap when you squat, climb stairs, or run, this is very likely what's going on. Research shows this is a highly prevalent disorder driven by dynamic biomechanical dysfunction. Now, what does that actually mean for us? In simple terms, the pain isn't necessarily because your knee is broken or damaged. It's because abnormal joint loading and muscle imbalances are pulling your kneecap, which normally acts like a smooth guide, right out of its natural track. When the muscles around your knee and hips get weak or overly tight, they dynamically change how that kneecap moves under pressure, and that is what causes that chronic, nagging pain.
Which brings us perfectly to Section 3, strengthening your knee defenders. It's time to build up the endurance needed to protect that joint.
One of the absolute best ways to build this protective endurance is the classic wall sit. The front of your thighs, your quadriceps, play a huge role in supporting the kneecap. So, you stand with your back flat against a smooth wall and slide down until your thighs are parallel to the floor. But pay extremely close attention to step number 3 here. Keep your knees stacked directly over your ankles. The most common and frankly the most dangerous mistake people make is letting their knees drift way past their toes. When you do that, you stop loading the muscle and you start intensely overloading the knee joint itself, totally defeating the purpose of the move. Just keep your back flat, your weight grounded in your heels, and hold it right there.
Next up is the terminal knee extension. For this one, you loop a resistance band behind a slightly bent knee and simply straighten it fully against the pull of the band. Why is this so incredibly effective? Well, clinical physiotherapy protocols highlight that this explicitly targets the VMO, that's your inner thigh quad muscle, right in the range closest to full extension. And that happens to be the exact range where your kneecap's mechanics are the most sensitive. Best of all, it activates this crucial stabilizing muscle without generating the painful compressive joint forces you'd get if you dropped into a deep squat.
Finally, for our defenders, we have the straight leg raise. Sitting tall in a supportive chair, just extend one leg perfectly straight in front of you. Hold it for about 5 seconds and lower it back down. Do this 10 to 15 times per leg. This is a brilliant, totally safe, low-load activation exercise. If your knees are highly irritated right now, this is exactly where you start. Keep in mind, when it comes to stabilizing the kneecap, consistency and building endurance matter far more than explosive, heavy intensity. Start slow and let the comfort guide you.
Section 4 takes a fascinating turn: the surprising footwear connection and how your everyday shoes alter your knee stress.
And this brilliantly illustrates a wildly counterintuitive fact from recent osteoarthritis research: 15%. Think about that for a second. That is the amount by which certain highly supportive, structured walking shoes can actually increase dynamic knee loading compared to just walking barefoot or wearing a flat shoe. Crazy, right?
To put that into perspective, let's look at some biomechanical data comparing peak knee joint loads across different types of footwear. The metric here correlates directly with joint stress. Look closely at the top. Stiff clogs and heavily cushioned stability shoes actually result in the highest knee loads, around 3.1 and 3.0. Now, compare that to the bottom. Flat walking shoes, flip-flops, and walking completely barefoot produce significantly lower knee loads, down around 2.7 and 2.8. Basically, those bulky, heavily engineered shoes designed for maximum foot support, they're actually transferring roughly 15% more mechanical stress directly up into your poor knee joints.
So researchers concluded that flexibility and heel height are the critical differentiating characteristics here. Flat, flexible footwear actually provides a massive biomechanical advantage for the knee joint. It allows your foot's natural movement to absorb the shock of walking, rather than acting like a rigid lever that jams force right up your leg into the knee. Now, a quick, super practical caveat. While flip-flops scored really well for low knee stress, they obviously lack secure fitting and can be a serious fall risk, especially as we age. The real sweet spot is finding a safe, well-secured shoe that remains as flat and flexible as possible.
Moving on to Section 5, Sleep, the ultimate painkiller and the hidden biological cycle of chronic pain.
Look at this quote directly from the literature. Pain can be both a cause and a consequence of sleep deficiency. It is a totally bi-directional relationship, which basically means it's a vicious cycle. Your knee hurts, so you toss and turn and get a terrible night's sleep. And because you didn't sleep well, your brain's pain threshold is actually lowered the next day, making your knee hurt even more, which ruins your sleep again the next night. But why does a lack of sleep physically make your knee hurt more the next day?
Well, it all comes down to biology. Poor sleep throws off massive systemic pathways in your body. It triggers HPA axis dysfunction and elevates your morning cortisol, which leads to weakened immunoregulation. Basically, it throws your immune system into a state of low-grade systemic inflammation. That means the localized inflammation in your knee is biochemically amplified. Furthermore, sleep loss causes a downregulation of your endogenous opioid system. That's just a very fancy scientific way of saying that bad sleep literally deactivates your brain's natural painkillers, leaving your joints hypersensitive to every single step you take.
In fact, treating inflammation doesn't just soothe the knee, it actively fixes sleep regulation right up in your brain. Studies actually show that anti-inflammatory therapies improve sleep quality independently of just reducing the joint pain by inhibiting inflammatory cytokines directly in the central nervous system. So prioritizing deep rest isn't just nice to have, it is non-negotiable if you want to turn your body's innate pain relief systems back on. Recovery happens while you rest.
Finally, let's wrap this up with the blueprint recap. These are your simple daily habits for long-term improvement.
Here is our ultimate, science-backed blueprint, 7 simple habits for healthier knees that you can start right now. Number 1, listen to your body and understand the crucial difference between a harmless catch and true medical locking. Number 2, strengthen your thigh defenders. Use low-impact endurance moves like wall sits and straight leg raises to properly guide that kneecap. Number 3, stretch those tight leg and hip muscles every day for just a few minutes to restore mechanical balance. Number 4, maintain a healthy body weight. Even modest reductions take immense mechanical pressure off the joint with every step. Number 5, choose low-impact activities like swimming or cycling to keep moving without all the pounding. Number 6, swap out those rigid, bulky shoes for flat, flexible, yet supportive footwear to instantly drop knee joint loading by up to 15%. And number 7, prioritize your sleep to turn off systemic inflammation and activate your body's natural painkillers. Remember, small, consistent daily changes in these areas are what produce the most massive long-term improvements in joint health. Healthy knees aren't built overnight.
And that brings us to the end of our explainer. We've mapped out the science, we've given you the blueprint, but knowledge is only power if you actually apply it. So I want to leave you with this question. Which of these 7 simple habits will you start implementing today to make your knees feel 20 years younger? Pick just one to start with right now. If you found today's explainer helpful, please give it a thumbs up, subscribe to Health Slash,
and turn on notifications so you never miss our latest health and wellness deep dives. Thank you so much for joining me. Stay active, stay healthy, and take control of your joint health.